Good day, global citizens. Thank you so much for joining us for another episode of Dr. Fajembola'S Opinion. On this episode, I brought someone I've known for at least 10 years. Yes, and he's a senior colleague, and I'm happy he has moved across US, China, and Nepal, and has impact, especially in the world of neurology. And I'm happy he's here to simplify and discuss his publication to us. So, global citizens, let's have a sit. And please join me to welcome Dr. Bivek Singh Rathore. Dr. Bivek, how are you doing?
I'm fine. How are you?
I'm good, Dr. Vivek. It's an honor to have you. If someone told me more than 10 years ago that someday you are going to bring on Dr. Vivek to discuss any of the publication, I'll be like, which on where, on which platform? So I'm happy we could work like this, and I'm so fulfilled that this is coming true. So let's take global citizens through the profile of Dr. Bivek Singh Rathore. He's a neurologist and medical educator with research interest in circadian biology, neurodegeneration, stroke, and chronotherapy. His work focuses on integrating circadian neuroscience into clinical and translational frameworks. He's also actively involved in academic mentoring and international research collaborations. So, what today our focus is on circadian rhythm and Alzheimer's disease. So, let's look at what global citizens are saying um, with respect to neurology. The first tweet I got was from Susanne Den Blot Tostige. I hope I pronounce her name very well. She's saying, when a BPD patient tells you a hero story about their therapist, and that story is a story about someone who should have been in the neurology department all along and not to be treated as someone with a mental illness. It's time to say, okay, but this is not a hero story. The next tweet is from Kim Marias, where he said, I agree with Andre Uberman on this. We know maybe 10% of human neurology. I also agree with Jordan B. Peterson that psychology will disappear as a field of study and be completely replaced by the field of neurology. Dr. Bivek, do you agree with that? That psychology as a field will disappear and be replaced with neurology? I believe they are both important.
Yeah, I think both are important and both have their own area of exploration that both fields are equally important because neurology and psychology they have to work together. But the statement that you told was um, only 10% of the things we know because there are many more things in neurology that we researchers and doctors are still looking into. And there are, if we could keep on doing the research, we get to know much more uh, deeper analysis of these neurological conditions and the link with the human body.
Exactly, exactly. Thanks so much for that, Dr. Bivek. The last tweet is from Abed, where he or she said, like any human endeavor, tests have built-in biases, etc. Also, recent advances in neurology find that the human brain is plastic throughout life and that IQ changes. So, whatever IQ you claim today is transient. The reality is that you can always become smarter or more stupid. Wow. I'm just knowing of that. So, Dr. Bivek, in my view, I feel one gets more intelligent. But I don't know. I feel as you grow, you get more intelligent. Is it possible for an intelligent person to become stupid?
Yeah. Yeah, that I think that depends upon the environment that the person is encountering every day. Because if you keep the same person in a different environment, definitely the growth of the brain, the intellect of the brain differs. So if we take a two-person, if one of the twins from to one country and another to another country, if we expose them to a different environment, the outcome differs. And here the term epigenetics uh, comes, where we talk about the influence uh, to the level of genetic level. So yeah, that's true that the influences of environment has in the intellect as well as it has in the growth of the brain. That's true.
Wow. Thank you so much for that, Dr. Vivek. I'm not a neurology expert, so any neurology question, even if it's an alphabet, I'm going to ask you. So let's dive into the discussion. Dr. Bivek has been patient with us today. The first our discussion today is on a part of neurology, which is Alzheimer's disease and circadian rhythm. And it's interesting when I read the publication as a clinician, it's interesting for me to see the correlation between the circadian rhythm and Alzheimer's disease. And there's a lot of thought about Alzheimer's disease. I've seen people with Alzheimer's disease, Alzheimer's disease. Some people say Alzheimer's disease, how it's pronounced.
Yeah.
Um, Dr. Bivek, what are three myths about Alzheimer's disease?
The three myths regarding the Alzheimer's disease is the first is it is a age-related conditions. So most of us we think that it is just age-related conditions, but this is not a age-related conditions. This is a neurodegenerative condition that is common in older age, but it doesn't mean that it is just linked with the age. There are several factors that is linked with Alzheimer's. Myth number one. The myth number two is Alzheimer's is just a disease that affects the memory. This is the common myth, and I think people should be aware that it is not the disease that is just related to memory. It has influence in the mood, behavior, sleep, and it makes the condition very debilitating. Like the person who is suffering from Alzheimer's, it is not just the person who is suffering, the family member suffers, the caretaker suffers. So the effect of Alzheimer's is not limited to a particular person or a patient, but it has influence in the within the family members. At the same time, Alzheimer is not just the disease of memory, it has influences. Like the person who is suffering from Alzheimer's, he or she has a problem with his daily activities. So there's agitation, there's confusion. The person is not able to do his daily work. He forgets everything. He cannot do what he used to do in the past. So it becomes like every day is a challenge for those persons. So it is not just related to memory. Now, the third myth about Alzheimer's is yes, there is no cure. That's true, but the complete sentence is though there is no cure, but if we detect Alzheimer's earlier, we can make the life better. So the goal in Alzheimer's disease is not to cure for now, but to make the life better and to help the caretakers as well as the family members to interact with this patient in day-to-day life.
Thank you so much for that, Dr. Vivek. I'm also one of the audience learning. I'm the first learner, as I tell my audience, I'm the first learner on this platform. Thank you so much for that, Dr. Vivek. What are three facts about the circadian rhythm?
The three fact about the circadian rhythm is evolutionary clock that is present in our body. So the first fact is circadian rhythm is not just present inside the human brain, but there are many clocks. There are many clocks that are present in our different organs of our body. So the liver has its own clock. The gut, pancreas, they have their own system. They have their own clock, and they work according to this clock. The clock that is related to the nature, and it is linked with the help of one of the factor. There are several factors, but light is one of the major factor that connects the nature with the human clock. So the clock works based on the light that it gets from the nature. So I can simplify this like human body has two different types of clock. The one is the central clock that is present inside the brain, and another one is the peripheral clock that is present in various cells and tissues of the body. And these clocks get signals from the nature, and one of the strongest signal is light.
So thank you so much, Dr. Bivek. This publication we're discussing is the correlation between Alzheimer's disease and circadian rhythm. So, what are three effects of Alzheimer's disease on circadian rhythm?
So the effect of Alzheimer's disease on circadian rhythm is that in the circadian rhythm, like most of the time, the association between the circadian rhythm and Alzheimer's, there are several research that are ongoing. But what we know about the circadian and the Alzheimer's is circadian rhythm, it is affected in the patient with Alzheimer's. And on the other hand, the disruption of the circadian rhythm in day-to-day life can be linked to Alzheimer's. So it's just a cycle where disruption of the circadian rhythm linked to the Alzheimer's, and at the same time, the patient with Alzheimer's, they have some issues with the circadian rhythm because people who are suffering from Alzheimer's, they usually has agitation more in the evening. So it's the agitation,
Okay.
yeah, growing in by the end of the day, like they get more agitated during the evening. They have a fragmented sleep, they cannot sleep properly, and there's a problem with the sleep. There is a more agitation and confusion in the evening, and these all are again linked to the circadian rhythm, because circadian rhythm is not just the rhythm that controls the sleep. The circadian rhythm is linked to regulation of temperature. It is also linked to regulation of hormones, cortisol, melatonin, and it is also linked with various metabolic activities, immune system. The immune cells has their own circadian cycles and circadian clock. So circadian rhythm is not just a sleep cycle. Circadian rhythm is not a sleep. Circadian rhythm is one of the factor that controls the sleep wake regulation. So it regulates the sleep wake pattern. So circadian rhythm is linked with Alzheimer's, but to know more about the deeper connection between the circadian rhythm and Alzheimer's, I think we need to wait for maybe next few years. We'll get many more paper because the number of paper is increasing every day. And one of my review paper, it's going to be published in very maybe 1 or 2 months. That is a narrative review that describes the importance of circadian rhythm for people suffering from Alzheimer's.
Okay, thank you so much for that, Dr. Bivek. I know you mentioned earlier the central clock and the peripheral clock on circadian rhythm. So on circadian rhythm, what should we know? What are the important points we should know apart from, oh, the central clock is in the brain, peripheral clock is on other organs in the body? What should we know about the central and the peripheral clock?
So the thing is that, as I told before, that our body has two types of clock: the central clock that is present inside the brain, and the peripheral clock that is present all over the body. Whenever we are working, like every day we are working, and we are exposed to light during the evening, because our lifestyle is changing and we are working at the night shift, or we are more exposed to light during the evening hours or maybe before sleep. And this light is one of the factor that's disrupting the circadian rhythm, because the nature, according to the nature, the sun, the sun shines in the morning and it sets in the evening. But we are creating a natural light, and this natural light is disrupting the circadian rhythm. So the first thing that we should know is that we should align with the rule of the nature. The rule of the nature is to not to increase the light during the night hours. But when we work every day in the evening, we may go for the hospital hours, or someone may be driving during the night every day. So these people are more prone to have affect their circadian health, circadian rhythm. So there's a more impact on the circadian rhythm for these people who usually do night duty every day or every 2 or 3 days, like nurses, doctors. At the same time, there is also the people who are driving every night, mostly at night. These people are more prone of, and the night guards. So anyone who is working usually during the night, or who is exposed to light during the night hours, these people has higher chance of circadian disruption. And circadian disruption is again linked not just to Alzheimer's, it is also linked to diabetes, it is linked to metabolic diseases, it is linked to obesity, and many more diseases.
Thank you so much for that, Dr. Vivek. I for a generation that has gotten used to sleeping late at night, working more at night. Some people work remotely, some people work for different in different time zones. So, and they have more exposure to light at night. I believe this is a good avenue for them to know the long and the short term effect of what they are doing on their health, especially doctors and nurses who are also the first and professionals in treating Alzheimer's patients. So, diving deeper into the publication, Dr. Bivek, I quote, you said amyloid beta plaques and tau tangles remain pathological or marks of Alzheimer's disease. Now, we encourage global citizens to go to read the publications of the researchers we bring on board. What should a layman know about these plaques and also the tau tangles?
So the two important hallmark for the Alzheimer's is amyloid plaque and tau tangles. So amyloid plaques are the plaques, they are aggregations, abnormal aggregations that are present outside the neurons, outside the nerve cells. And the tau tangles are the abnormal phosphorylated aggregations that are present inside the neurons. So these aggregations, again, it is linked to somehow to circadian, not fully, but it indicates that the mechanisms that was used to discard those aggregated proteins outside the brain have stopped. So it's just like the cleaning mechanism of the brain did not work properly. So that also means that whenever a person brain has amyloid deposition and the tau tangles for a longer period of times, the neurons they keep dying. There's inflammation. There's a problem with the communication between the neurons, and as the neurons keeps on dying, the person starts suffering with various symptoms that is presented in Alzheimer's. So all the symptoms that are exhibited by patients suffering from the Alzheimer's, it is linked to the aggregations of amyloid plaque and tau tangles.
Dr. Bivek, diving more into the paper, you mentioned earlier where a disruption in circadian rhythm leads to systemic implications. Now, give us examples of systemic disorders that have been implicated in disruptions of circadian rhythm.
So whenever there's a disruption of circadian rhythm, first I will tell some of the examples that is related to my research. Then I will also talk about some of the examples that are available in the literature, but that's not related to my research area. Stroke is related to circadian, because the onset of stroke onset time is it's like we did a research taking 2 years, and in a hospital. Our research result shows that the circadian rhythm has influence on stroke onset time. It has an influence on the severity of the stroke. So one disorder is stroke. The second one is the Alzheimer's, as we are talking today. And some other examples are headache, and Parkinson's. If we talk about the non-neurological conditions, there are several non-neurological conditions: obesity, metabolic diseases, diabetes, cancer. Even the cancer cells, they show circadian variation. So maybe in the future, we will move where we will use the anti-cancer drug in certain time of the day that is more effective. So the cancer cells, they behave differently in within the 24-hour time period. So that will help us to um, do more research in the chronotherapy, where we'll be advising the patient to take the drugs in a particular time of the day. So these are the different conditions. Either it's neurological and non-neurological conditions, from metabolic disorders to obesity to cancer to neurological disorders like stroke, Alzheimer's, and Parkinson's, headache, that are linked, that are associated with the circadian rhythm disruption.
Wow, wow, that is enlightening. Sorry, I'm laughing. I said I'm the first learner. That's enlightening for me because I'm ready to rethinking my life. Okay. In one of the tweets earlier, before we started the discussion, we talked about the brain plasticity. So, Dr. Bivek, what is the correlation between the circadian rhythm and synaptic plasticity, if any?
So when there's a disruption of circadian rhythm, it will lead to it is one of the reason that leads to the deposition of amyloid plaque. I cannot say that it is directly linked to the amyloid plaque deposition, because there are several other factors that is playing important role, but one of the reason is a disruption in the circadian rhythm. So when there is circadian disruptions, definitely in long run there is a problem with the synaptic transmission. So the neurons, two neurons, they cannot communicate with each other. So the synaptic transmission will get interrupted. At the same time, there's inflammation. There's increase in the inflammation. The immune cells that are linked to brain, they do not work properly, and other cells that are protective in nature, they won't be in the position to protect our body. So disruption, it will lead to, it has a effect from the molecular level to the organ level. Like, molecules, they don't work properly. They do not work as per the rules that was meant for them. At the same time, the organs also stop functioning in the normal way. The normal physiology gets disrupted.
Okay, Dr. Vivek. I'm correlating the discussion and connecting the dots. What is the visibility of chronotherapy in Alzheimer's management? I remember in one of the tweets I mentioned chronotherapy. So what's the visibility of chronotherapy in Alzheimer's management?
So chronotherapy is not well advanced, but there are so many research that are ongoing, that indicates that in the future, chronotherapy will be one of the area that gives a better hope for the patient suffering from Alzheimer's and many other diseases. Because chronotherapy is just, we are focusing on a therapy based on the chronology. So we will give that medicine in a particular time of the day. So some medicines, they work, the effectiveness increases if you give at morning, at the early hour of the day. Or maybe for some medicines, it becomes more effective if you use that medicine, if you advise to have that medicine in the evening time. So this is all the chronotherapy. So chronotherapy, it is a huge topic. It might take years to understand the concept for each disorders linked to chronotherapy, but it is a hope. It is a hope that if we follow chronotherapy, we will be able to manage this condition in a better way.
Okay, Dr. Bivek, one thing is when I bring in experts on topics like this, I usually add little or nothing to it. So let's move to the next question. What role does chronoepigenetics play in circadian rhythm management? Is it the same with chronotherapy?
Chronoepigenetics is a different thing. Like chronoepigenetics is the genes, if we go to the genetic level, even the genes, they function differently in different time of the day. So
Okay.
that is interesting because we think that the genes they function equally in every time of the day, but in maybe in the morning some genes work but are more active in the morning, some genes are more active in the evening. So even the genes they follow the time. So it's from the genetic level. Genes they follow, they have their own timing. The cells they have their own timing, and the tissues and the body organs they have their own timing. But our timing is totally against those timing. They align with a particular time. The cell, the genes they have their own time, and the human time that is totally artificial. So it's like totally different. So it's not aligning. Our timing is not aligning with the body's cell and genetic timing.
So thank you so much, Dr. Bivek. You talked about your future publications, and there is lots of publications coming up on Alzheimer's and circadian rhythm.
Yeah.
And where do you see us on the management in the next decade of Alzheimer's disease? Because as I said, I've met people with Alzheimer's disease. I know some people with Alzheimer's disease, and God forbid, I'm saying God forbid, but you don't know. I may develop Alzheimer's disease tomorrow, or someone very close to me, very, very close to my disease, will develop Alzheimer's disease. So, where do you see us on the management of Alzheimer's disease in the next decade?
So I think every month, every year, there are so many new research that are upcoming, and they are trying to explore the relationship between the Alzheimer's and various factors that are linked to it. And chronotherapy in Alzheimer's is another area of research. Similarly, circadian rhythm in Alzheimer's is another area. There might be some other area that are upcoming, and I mean, maybe in next 10 years, next by next decade, we'll be able to manage these conditions in a better way. We'll be able to detect the condition in a better way, because recently there was a paper published in one of the reputed journal. I forgot the name. It was about biomarkers in Alzheimer's. So maybe if that is possible, so we'll be able to detect the Alzheimer's earlier, we'll be able to manage it earlier. And if chronotherapy and chronoepigenetics concept get clearer in the future, we may be able to come up with the personalized therapy. Personalized therapy is like every person, we define the therapy based on the person's symptoms, based on the person's features and everything. So it is a therapy that is different for a different person. That is different for different person. That is the um, one of the area that is rising right now. Like many research papers, they talk about the chronotherapy, not only in Alzheimer's, but also in other diseases like stroke and Parkinson's.
Thank you so much for that, Dr. Vivek. This is a question which is out of the scope, but I'll be glad if you answer it. You mentioned exposure to light,
Yeah,
and I would like to know, just is it the phone light or the light in our homes? And I know the light in our homes, sometimes we have white light, sometimes we have yellow light. Is there a
yeah.
specific type of light or all types of light that affect our circadian rhythm?
The light that is more important for us to know is the blue light. So yeah, the phone also it emits the blue light, and there are different types of like red, green, blue. Out of these three, the blue light has more effect on disrupting circadian rhythm because it resembles with the natural light. So what I advise is whenever like before 2 hours before sleeping, we have to change that mode into night mode whenever we are using the phone, because whenever you
Oh,
change
okay.
that into night mode, the night mode light has less component of blue light.
Wow.
So that will help, and that is the technology that has been that is integrated in those phones. If you check your phones, you will find that there is an option where you can choose night mode, and once you choose
Exactly.
night mode, the brightness decreases. At the same time,
Yes.
the component of blue light also decreases. So once the blue
Yes.
light decrease, we cannot tell that it is completely safe, but at least we can tell that definitely the blue light is less. So if the disruption, circadian disruption is less, and we may get to sleep in a healthy way.
Wow. Thank you so much for that, Dr. Vivek. This is our first time discussing a topic related to neurology, a topic related to Alzheimer's disease, a topic related to circadian rhythm on this platform. Thank you so much for sharing your time and your expertise to
Thank you so much.
explain the correlation between Alzheimer's disease and
Yeah.
Circadian Rhythm. We look forward to bring you on board in on future episodes to discuss maybe Circadian Rhythm, more on Circadian Rhythm and Alzheimer's disease, all and the scientific topic. Thank you so much for making it look simple, making it sound simple, even though when we know it's not simple. If you're a medic, you know neurology is not a simple field. So thank you so much, Dr. Bivek, once again. Global citizens, we went through the publication of Dr. Bivek Singh during the week, and Alzheimer's disease is a common condition for everyone in our community. We everyone knows someone who has Alzheimer's disease, and we all sleep and we all experience the circadian rhythm every day. So this is a publication everyone who comes across this video should read and also watch this video to understand more on the publication and ways to improve our lives. That is the essence. This platform is a platform where research meets understanding and legacy, and it's we're optimistic this will improve the health status of global citizens and reduce the mobility and mortality faced by global citizens. So thank you so much once again for joining us this week. Have a blessed week, everyone.
Thank you, Azizat, for your time and for letting me to speak my about my research in your platform, and help me share my research work with the audience from all around the world. I want to thank everyone who has been listening to us for like 1 hour, and maybe in the future we'll be collaborating with some other projects. Thank you, everyone. Good night.
Thank you so much for your kindness, Dr. Vivek. Thank you.
Thank you. Good night.